Mic check, 1, 2, 3, mic check.
Hello, everyone. Today, April 17th, this is our briefing on this disease that has, for all practical purposes, shut us down, inconvenienced us. We've lost loved ones and many different aspects that we're trying to contend with. Now, before I go any further today, I'd like to just say this, that one of the things that's been on our hearts and minds an awful lot and brought even more to our attentions is the need, and to be able to do what I've said in the past, and that's run to the fires, especially the fires that are at our nursing homes. Our nursing homes, we all know, the most vulnerable of all of our people. This disease has a way of attacking the elderly, and these people are the ones that we moved on the very first thing that I did from the standpoint of restricting visitation or eliminating visitation. Now, we still can't seem to completely wrap this thing up. We got a lot of people that are doing a lot of good stuff, don't get me wrong, but you saw that yesterday I was not very happy, and the primary reason that I was not very happy all centered around one nursing home in Jackson County, and just to tell it like it is, I just read this again to you, but if my people find anything that has been done wrong, you can believe that we'll absolutely react, and we will react in an extremely strong way. We're still investigating that situation, but the entire situation with our nursing homes is not as good as it needs to be. We're having parts of our populations that have been tested. We're constantly getting back, that we've got 2 positives that have been, that have come up at a certain nursing home, and we have not tested the entire population. And then we go back and test the entire population. So in order to get this under control completely, I am today issuing an executive order, and I am issuing this order directing the DHH, with the help of the National Guard, to test or retest every single resident in all the nursing homes as well as all the staff. Now, we're going to go back and we're going to test everybody. Every single person in every nursing home, every resident, as well as all the staff. And then we're going to log all this in. We're going to get it done immediately, and we're going to log all this information in so that we can better serve our most elderly and the people that have given us wisdom in many ways for decades and decades. And we've got to do better to do that entire process than what has been done thus far. It keeps coming back to me over and over and over with some level of discrepancies, and to be perfectly honest, I'm sick and tired of listening to the discrepancies. So this way, we got to go back and redo everybody. So from the standpoint of all those that are on the front lines at the nursing homes, whether they be staff or the owners of the nursing homes or whomever it may be, all my praise to you and all my praise for the efforts that you've put out, and you're doing good stuff and everything, as well as all the healthcare people and everything that are working on this. There's a lot of people doing good stuff, but just doing good stuff's not good enough. I mean, that's when it really boils right down to it. That's not good enough, because there's people that depend on us beyond belief, and to be just as frank as I can be, some of those people are dying. So just good enough's not good enough. I mean, it needs to be perfect. And so we're going to go back and retest everybody. Now, I don't have a lot today to report to you other than, I'd like to go back and just talk just a second about what our president came out with last night. And you saw, I wasn't able to go through and one-up him from the standpoint of, even though I knew the information, I wanted him to have the opportunity to present it. It is a phase 1, phase 2, phase 3 deal. it is based on entering the phase 1, that you've got to have 14 days of a good curve and really look like you're moving in the right direction and everything. And then when you move into phase 1, there's all kinds of different things you go through. One of those is not go back to school at that point in time. When you move to phase 2, that's going back to school, and that's opening up, parts of different types of travel and non-essentials and different things. And then hopefully at some point in time we bridge to phase 3, and that opens up a whole lot more. Now, I can tell you that it is on all of our minds that we need to some way transition out of this disease and getting our engine back going and go back to work. Now, and everybody's going to be trying to obtain and do just that. I've said over and over and over, I'm not going to back away in any way from protecting you and listening to our medical experts. But I can tell you that it is a priority beyond belief to get you back to doing the things that you would like to do with your life and get us back to work. So, it's a balancing act. It's very, very difficult. It doesn't matter that it's very difficult. I'm in the position, and I take the position with great honor, and I'm going to do the very best that the good Lord gives me the capability to be able to do, to protect you on one hand and get us back going with our lives and back to work on the other hand. Now, I want to read this to you. I've directed the DHHR to file an order effective today requiring laboratories to provide immediate, real-time electronic reports of both positive and negative COVID-19 tests to the DHHR and to the local health departments. Most of the labs are already doing this, but we don't have the expediency that we need from all the labs. So again, I am ordering the DHHR to put out an order effective today requiring the labs to provide immediate real-time electronic reports of both positive and negative COVID-19 tests to the DHHR and to the local health departments. I'm just trying to look, they're showing me one other thing. We processed over 14,000, unemployment claims yesterday, and Scott Atkins is going to be with us on Monday to give us some more updates on that. They've promised that by next week we'll be caught up. We're trying to process all those claims as fast as we possibly can, and I'm proud to say that there's real relief coming. Now, I'd be remiss if I didn't go back and tell you just this, that even though on the first phase of the rollout of dollars to the small businesses, that's shut down for right now. And, I got a call last night, and a gentleman, he had made the application and everything, but he couldn't get approval from the bank that it had been submitted and everything. It just went on and on and on and on, and then boom, they shut it down because they ran out of money. They put $350 million out there in the beginning, or $350 billion, and basically it got shut down because they were overloaded and everything in every way. And I've mentioned this over and over that the Senate, wanted to put another $250 billion in it, and it kind of got blocked, with Nancy Pelosi and everything that was going on, and they haven't really moved on yet, but here's what I would say. I would say if you're one of those that's still wishing to apply, don't become discouraged, because absolutely I feel like, now I can't promise this and everything because I surely don't run Washington in any way, but I do feel like that backlog will be taken care of, and they will put additional dollars in that to be able to satisfy your request as well. Keep working it from a personal standpoint. Keep working it from a business standpoint. We're working it from the state government. Like I said yesterday, we got basically a wire that rolled into our bank account of $625 million. That's all the money in the universe. and especially all the money in the University of West Virginia, and they said that's only half, and there's more to come. We're working it in every way to bring every dollar to this state you can possibly bring that will help everything from our hospitals to higher ed to K through 12 to all of our businesses to basically backfill government where we're not having to lay people off and we're not having to cut services. So you work it, we're working it, we're here to help you in any way, and we're going to continue to do so. But I think that's all I've got.
All right, thank you, Governor. Up next, let's go to Major General Hoyer with the West Virginia National Guard.
Good morning. 632 National Guardsmen have completed 447 missions. We continue to add personnel to the 502F authority, which the governor was able to secure along with our 2 United States senators, that allows us to fully fund the National Guard personnel in federal status. A couple of key highlights over the last 24 hours. The West Virginia National Guard is the first unit in the Department of Defense to have a Department of Defense approval for a mobile lab system. Thanks to a young lieutenant, Samantha Fabian, who also happens to be a PhD candidate, she was able to push this through the process. So we will have 2 DoD-approved mobile labs when materials are available that we can use in our efforts throughout the state. A couple other key innovation activities. In Spencer, West Virginia, we are producing our first set of Gore-Tex surgical gowns, which we will then have tested with West Virginia University and NIOSH. Shepherd University has produced a mask that has been tested and with some tweaking to the filter actually exceeds the standards of an N95 mask. And we are working hard now to develop a process to put those in a level of production that we can use those masks for both this event as well as the phase 2 and other activities going forward. Continue to have strong development, as the governor mentioned, with Workforce West Virginia, the improvement and installation of technology such as the Amazon Connect, and then the next phase next week of the customer relations management system. We have trained to date 570 retail stores. We thank the Retailers Association and those folks from the restaurant and beverage industry who have not only accepted our training, but worked with us to improve the training over time. We are also in the process of providing training at the nursing home facilities at the direction of the governor to again improve capabilities going forward to reduce the threat. Our food bank initiatives are going exceptionally well. I just want to point out a couple of key indicators and benchmarks. We normally, the food bank system serves about 115,000 families in West Virginia. We are now up to 200,000 families being served on a regular basis. We've gone from $150,000 a month to a $500,000 a month spending for food. Today, the National Guard is securing 12 additional refrigerated trailers because the food banks were able to secure some low-cost purchase foods as well as some donations so that it will improve our capacity to serve those families that need our assistance. And at the direction of the governor, we're working with VOAD as well as the food banks to stand up a third location for a food bank to better serve our citizens going forward as we address the challenges we face. And last, we are working with the West Virginia Broadband Enhancement Council and West Virginia University, Marshall University, CAMC, and others to both improve rural broadband support and technology for telemedicine, but also to leverage the opportunities that exist within the CARES Act to improve those things going forward, not just for this event, but for our citizens going forward. Thank you.
All right, thank you, General. Up next, let's go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning, and it's great to be with everybody. I'd like to focus my comments here briefly on 3 areas. So number one, I want to comment on our long-term care facilities, as the governor has stated, and certainly as we all recognize. When we look at this group of vulnerable West Virginians, we know that in Europe, about half the COVID deaths in several countries come from the population of people that are in long-term care or in nursing homes or extended care facilities. So we know this is a very vulnerable population. And as the governor has, I think, done in a very aggressive way and appropriate way to start to look at how we can understand the environments in these homes. And there's been some recent information that's been published that gives us further insight on how COVID-19 is spread. And in a study done in the journal Nature Medicine, the investigators working in China found that about half or so of the people that spread COVID-19 were about 2.5 days to about a half a day able to spread before they developed any symptoms. So the pre-symptomatic phase where the virus is high, and we've talked about that before in the initial study from China where the swabs were done, where very high viral titers were found in the throat and the nose 1 to 3 days after people were infected. So it gives us this insight that a lot of people may be spreading the virus who are not symptomatic. So that's the reason why it's been great that our citizens have protected themselves, used their power, hand washing, avoiding your nose, social distancing, physical distancing, and staying at home. But it also says that in these nursing home outbreaks, at least in Europe, these were often transmitted by people that were not symptomatic. So being able to have a vision of what's going on as a surveillance level is important. And as we think about moving to the next stages, as President Trump has outlined, I had a question about how are we ready to test? And certainly we know, like every other state, we need to continue to expand our testing capacity. But we are creating, I think, the resources and the partnerships to be able to help us move forward successfully. So for the second thing I'd like to do, I'd like to shout out to General Hoyer and his team, but also as we've talked about the impact of our universities and our innovation groups, I want to shout out to our West Virginia University innovation team that's really been spearheaded by Dr. Laura Gibson. We've talked a bit about testing masks and looking at barrier function. That's been spearheaded by Dr. Tim Nurkowitz, who's worked with the National Institutes of Occupational Safety and Health. Now we're working with the engineering schools, and Dr. Gene Salento is helping lead an effort for us to 3D print swabs that we need for further testing. And so as we look at the testing that we need to do for the state, we know that we need to expand the current testing we have, but also start to look at bringing out a separate kind of testing, which is looking for evidence of immune response to the virus or antibody testing. And so we're starting to gear up to look at that as well, because that way we could understand the impact of the people in West Virginia and who's been infected with the virus and who hasn't, and potentially who may be immune to the virus and who hasn't. So the third thing I'd like to talk about is where we are as we go forward. Certainly, West Virginia is still doing great. We had still a very low conversion rate overall of 4% versus national average about 20%. Over the last 24 hours, we've had a conversion rate of 2%. And people are asking, well, you've said that 14 straight days of lower number of positive cases are really critical for us to be able to start back on the health side. And I would just say, just like the models that we talked about from University of Washington, we're not looking at every single day as a linear sort of, we have to get this day or we're done. We're looking at trends. And certainly people in West Virginia have done a great job. As we look nationally, we know that the average mortality rate in any state is about 4.6% now. West Virginia is 1.7%. And we are doing much better than really any state, in my opinion. But as we know, that we can't be complacent. And as we come back again, as the president has indicated and the governor has indicated as well, and we all want that to happen for the state, to get people back to work, to get people back in school and do the kind of things together that we all enjoy. But we are committed as a team to make sure that we make every recommendation to the governor, who has a great heart for the safety and the health of this state, so that we do this safely. And I think the most important thing, I'm going to re-emphasize this, and I think I'll re-emphasize this every single time that I am in front of anybody, is the fact that every citizen here has listened to what the governor has advised. And by using your power, you have kept us in this incredibly good position right now. And we talked about staying at home if you can, staying physically distanced, washing your hands, avoiding your face, your mouth, your nose, reducing your ability to get the virus, and also reducing your person-to-person spread of the virus to reduce that rate, flatten the curve, reduce the surge. This does not change as we get back together. And certainly as we feel comfortable, we'll make specific recommendations. But any time that you can, practice your own great habits, your learnings, what your power is against the virus, because we want everybody to stay safe. And as we go back out again, we know the virus is still there and we still have a vulnerable population. So I think with your good care and you using all the tools that you've learned, we will successfully navigate this next phase and the next phase and the next phase. And as we are giving ourselves time and staying healthy, new drugs are coming up and some are looking very promising. New vaccines are being developed. So we will get through this. And I believe that we will be the model for the country. So thank you, West Virginia.
All right, thank you, Dr. Marsh. Next, let's go to the West Virginia DHHR with Secretary Bill Crouch and Dr. Kathy Slim.
Good morning, everyone. Let me start by talking about insurance or lack of insurance. If we have individuals in the state who need testing, we want to make sure that that they do not avoid seeking a test for COVID-19, even if you're uninsured. The Families First Coronavirus Response Act, which was HR 6201, requires all health plans, including Medicare, Medicaid, and employer-sponsored health plans, to pay for COVID-19 testing. So this includes lab fees and fees associated with the office, clinic, or emergency room where the test is administered. Health plans cannot impose cost sharing or prior authorization requirements for COVID-19 testing. Individuals are not required to pay a Part B deductible or any co-insurance for COVID-19 testing. Clinical diagnostic labs are covered under traditional Medicare at no cost sharing, and COVID-19 tests are covered under Medicare Part B as well. A provision in the Families First Coronavirus Response Act eliminated beneficiary cost sharing for COVID-19 testing related services for those receiving traditional Medicare. So please, if you believe you need testing, that will be done at no cost. Contact your healthcare provider. It is best to contact your healthcare provider and not go to the office. Most of these or many of these orders are being done through telemedicine or online. So do that, and please do not risk contaminating or introducing the virus to other individuals by going into an office. So thank you for that. I want to mention the governor talked a little bit about the order that really helps DHHR provide information quicker. We talked a lot, and the governor's talked a lot about getting accurate information. We have about 34 labs that are not connected electronically. The system we have in West Virginia is probably like many other states. It was not built for this volume of service. It was not built for testing this many people over the amount of time we're testing those. We have over 750 people that have tested positive in the last 5 weeks or so. We need to get that information sooner. Pulling these folks in electronically will do that. We had a situation last week where we had 36 total positives, and those were all faxed to our office from Texas. That's not acceptable from our standpoint, and we're fixing that. We need to keep our dashboard up to date. Part of the problem with the dashboard is that we need health departments, and we have some great health departments in the state, but we need that information sooner. A good example is one of our larger health departments, Kanawha Charleston Health Department. They did a press release yesterday, 5 minutes before the governor's press briefing, about 9 individuals in Kanawha County, and yet they faxed that information in late last night. There was no electronic entering of the information until this morning, and we had to do that. So we've got to have better communication. We've got to have better data, and we're willing to help folks do that. So we're going to hook everyone up electronically so that we get data quicker. We keep our dashboard up to date, and we give more information to the public. So we're trying to be transparent in this. As for your patience on that, as the system changes, we have to move and change the system with us, and sometimes that's a little slow. We apologize for that, but we are moving that very quickly now. Kathy has a couple of comments based upon this as well.
Sure, and just again, thank you to the governor for his leadership in this arena of making sure that we do receive these reports electronically. That makes an enormous difference for our system, both in COVID-19 and longer term. So of the 34 laboratories that the Secretary mentioned that we are working to really get on board in electronic reporting, we have ramped up surge staff to make sure that we can work with each of those individually as quickly as possible to get that on board. And we want to give a shout out both to the facilities that are really so actively moving forward. So the first ones that have really been taking that lead have been Cabell Huntington Hospital, Wheeling, Princeton, Grafton, Sonic Healthcare, AIT, Q Labs. These are all really great testing facilities who are really jumping on board and making sure they do that quickly. So it's shout out to those folks and to the staff that at all levels that are really making that happen quickly. Also want to note that the Vital Registration Office is still receiving and filing new birth and death certificates as usual. We've had that question come up. The Charleston office has closed the walk-in office for ordering in person, but the public can still order certificates by mail or online through the Vital Check system. And those ordering instructions are available on a link to the DHHR webpage. The office has also placed order forms outside the Diamond Building in Charleston. So those processes can continue in communities. Thanks.
All right, thank you. Once again, we are holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, could you expand and be a little bit more specific about your executive order regarding the nursing homes? Exactly how many patients are we talking about? How many staff members? What's the timetable for getting this done? And what personnel and resources will it require?
Charles, my order is really just real simple, and it's just this. You know, I do believe we have the capabilities now of doing the testing, and I absolutely want every single resident and every single staff member of every single nursing home tested as quickly as we possibly can. And then, even if we have already tested these folks, I want them retested. So there will be no doubt whatsoever that we won't be missing something. You know, that's the whole thing. Right now, I'm concerned that we're missing something. And with that, I've said it over and over, every one of these people have brought wisdom to all of us for decades and decades. And the net of the whole thing is just this: these are not statistics. These are names and families, and they absolutely deserve the very best from us in every way. This is not anything that I'm upset or mad with anybody. You know, not the nursing home owners, not our healthcare networks, not our people in here. I know everybody's doing a great, great job, but let's just be fair, and the fairness is really simple. We've had too many discrepancies to where it looked like and it is like we could be doing better. All of us, every one of us. And so from my standpoint, if we can do better, that's what we're going to try to do. And so that's just it.
All right, thank you, Charles. Up next, let's go to Stephen Allen Adams with Ogden.
Yes, this is Stephen Adams of Ogden Newspapers. I want to kind of go back to yesterday real quick. I figured there's going to be a bunch of questions about the nursing home issue, but I want to turn back to the rule that was released yesterday in regards to tightening occupancy restrictions in stores across the state. I know the issue that seems to be a hang up is I think you all had put it at 3 people per 100 per 1,000 square feet in places that do 80% of their business by selling groceries. I know counties have had tighter restrictions than that. Wood County had 2 per 1,000 square feet. I know Kanawha County had a release yesterday raising complaints about that being loosened because they had a similar restriction. I know a couple other counties had similar restrictions as well. Can somebody, either Dr. Crouch or Dr. Slip, explain the logic of reducing that? And the other part of that question is this too, the tighter restrictions were only originally in the 12 counties that you did the executive order on last week that ended up getting spread to 12 counties. So can you talk about why we are now applying that statewide versus just in the 12 counties that obviously have the highest volume of cases? Thank you.
Stephen, let me make a stab at the beginning, and I want to pass this off to my general counsel, Brian Abraham. Brian probably knows this better than any of us and everything, but well, Brian, I'll let you talk, please.
All right, Stephen, we had contact from our various retailers around the state as the hotspot counties would go online and adopt their own policies. Some felt that it was difficult to comply with those rules. In fact, yesterday, as the governor made this uniform rule across the state, some of the counties actually were less restrictive than what the governor put in place, and now they're following the uniform guideline. Again, and you had retailers that were having to do business in multiple counties having to try to learn and follow various rules from all those different jurisdictions. So we had several of the counties, as I saw today, actually praise the governor's action yesterday, including Wood and Monongalia County, that they welcomed the guidance that the governor gave. We understand Kanawha County had a press release out yesterday criticizing it. I think that was very short-sighted on their part. And that tends to be a trend that's going on down there every day, but I can tell you that that was done with both the retailers in mind, the public safety in mind. We had some retailers tell us they would not be able to operate, and if we had our grocery stores closing down around West Virginia, I can assure you that would cause a much more panic than what we're dealing with right now.
All right, thank you, Stephen. Up next, let's go to Kenny Bass with WCHS.
This is Kenny Bass with Channel 8 and Fox 11 in Charleston. I have a question that's related to the nursing homes, but it's going to spread it out a little bit more. There have been 2 people who have tested positive at the Woodlands Assisted Living community in Huntington. So while that is not a nursing home or long-term care facility per se, it deals with much of the same population. Governor, is anybody looking at the retirement communities and those long-term communities that are both in Huntington and Charleston and throughout the state? And is there a possibility that those places should be included in your executive order, since many of the same vulnerable populations living in nursing homes are living in these same retirement communities?
Kenny, I just say this, and I'm going to pass this to Dr. Marsh or Dr. Slimp or Secretary Crouch, but I would say that as we go through this, everyone needs to realize that this is, and I'm not laying anything off here, but this is a pandemic with 1,000 different tentacles. And every one of these that you try to wrap up and secure, it'll lead us to something else. And so we just continue to knock down every single barrier as we go with every report we get. And so it may very well be that all the retirement homes or whatever you're referring to there, Kenny, have to be our next step. We can't knock down every barrier all at once. We can't absolutely eliminate every single exception. It's something that none of us have dealt with. None of us have ever dealt with this before. And with that, West Virginia is leading the way, surely leading the way east of the Mississippi River, surely leading the way from the standpoint of any kind of populace at all. And so with that, again, I commend everybody from our Guard to our health communities to everybody that is making all that happen. As Clay Marsh just said, Dr. Marsh just said, absolutely, we always are going back and commending you, our West Virginians, you that are absolutely doing all that you can possibly do to prevent a catastrophe from happening within our state. Again, the highest risk state of all, the state that has the most chronic illnesses, the highest risk state of all, and you're leading the way. You got to stay the course. But anyway, if Dr. Marsh or anyone could help with that answer, go ahead.
Well, maybe I'll take a stab, and then maybe I'll ask Secretary Crouch. Do you want to start?
I can, Clay.
Yeah, go ahead, Bill, and I'll just make any other comments if I have any left.
Very good. That is a retirement life center in answer to your question, Kenny. They have various levels of care. The long-term care portion of that would be included under the governor's order. And of course, we would look at other parts of the facility in terms of problems. We have non-pending tests from Woodlands right now, so we're aware of that and we're following that as well. Governor's absolutely right in terms of how this works. As we do that investigation, it is like tentacles going out, and we then find other areas we need to investigate. So, but Woodlands, the long-term care portion of Woodlands would be included in the order. Clay?
Yeah, if I could just make one other comment, Kenny, because I think your question is a really good one. So as we are looking at trying to surveil populations or start to look for problems before anybody even knows that they may exist, which is something that at the next phases we want to start to also bring to the rest of the state. That I think looking at the priority and the real risk of vulnerable populations, and we know people that are in positions where they're immobile, where they need care provided by people from the outside, are in particular vulnerable positions. People living in tight communities, retirement communities, et cetera, who may have chronic medical problems are also at risk, but differently at risk, since they can sequester themselves and protect themselves better than people in a long-term care facility or nursing home, or as Secretary Crouch has talked about. So I think that those differences are things that we will have to investigate. But I think this concern about making sure that we are understanding the most vulnerable populations and facilitating doing some screening and or doing some surveillance over these is really important, because as we said, this virus can spread at least, in good part before people have symptoms.
All right, thank you, Kenny. Up next, let's go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. President Trump's guidelines for reopening parts of the country, which has been discussed during parts of this briefing, recommends that before states enter the first phase, they confirm a 2-week downward trend in coronavirus symptoms and documented cases, as well as make sure robust testing is in place. Dr. Marsh has touched on these, but I'd love a bird's eye view from the governor and others about where you think West Virginia is on achieving those precursors to coming out of this. And I would also love a general explanation of where West Virginia stands in terms of testing capacity versus what still needs to be done. Thank you.
Thank you, Brad. Let me just lead off by saying this. All of these answers are going to have to come from the experts in our healthcare communities. Now, if we're getting an absurd answer that's coming from an expert in our healthcare community and everything, then I'm going to try to intercept the absurd answer. But when it really boils right down to it, they're the ones that have the expertise in evaluating our curve as to how we've been doing. We've been doing good for a long time, and we've had a significant drop since that April 7th or whatever, 8th and 9th dates. But they have to be the ones to evaluate. And then right behind that, they absolutely are the ones with our guard and everything to tell us our testing capacities and our bed capacities and basically our strike force capacities if we have a breakout once we start back to work and everything. I think we're probably closer than you may think, but at the same time, our experts are going to lead us on this, and I'm surely going to be listening very closely. But any of y'all that want to weigh in, from the guard to our experts, y'all weigh in.
Well, maybe I'll start off with some comments and then turn it over to others. I think this, Brad, this is a really important question, and it's one that we're very much actively building more capacity. As the governor said, we've been doing very well compared to almost any state related to the positive rate that we see. And so, as we've looked at it, we've even gone down more from our 4%, which has been our cumulative statistic. So from the standpoint of looking at the case positivity rate, we do look good. And we remain pretty stable. There was that one blip when we had the reports back from Wayne County, but otherwise we've been doing really well that way. When you look at our testing capacity and look at some of these other infrastructure sort of requirements or important opportunities as we start to bring people back together and start opening up businesses, we know that we have the capacity today in our state, if we look at just in-state providers, to probably process and do somewhere around maybe 2,500, 3,000 tests a week. And as we look at our partners outside, when we look at LabCorp and others, we know that we could increase that as we had the need and the demand. We also know that there are critical supply chain issues that have been involved with testing, not just in West Virginia, but throughout the country. The swabs that we use to take the samples from the nose were produced in Italy, and we know Italy had a lot of problems. So we, with the Guard and with our universities, are trying to become more self-reliant and create our own supply chains, our own resource set. And so we know that will go up over time, and that will expand our ability to test even more. And we're looking to create critical partnerships, which we will hope to announce some of those here coming up in the near future, that we believe will enable us to scale our opportunities to do testing, to do surveillance, so that we can have a system that tracks people who might be getting sick, before a human person needs to maybe be involved, and maybe some care opportunities to help people stay at home that would be care that could be brought to them in a different way. And then also maybe the ability to read our first line responders, read how they're dealing with the situation, look for early signs of any infection if we do get a surge. So we are thinking about these in very clear terms, and I think we'll bring some interesting solutions to the state that will be very unique and very novel. But all this is done just to try to help the governor make the best decisions. And as we've said before, there's no perfect strategy for this. This is all new. And we have a really smart team of people, and we're bringing in even more smart people to the mix. And this is one that we believe that critically, with the cooperation of our citizens for what you're doing now as a citizenry, which is making a huge difference, that we can be the model here again. But a lot of this is going to be also trying some things and then judging whether those things work and then moving back and forth. So this is really a rapid learning model, as well as it is that we have a blueprint for this.
All right, thank you. Brad, up next, let's go to Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron from WSAZ. I wanted to ask about the consistency in enforcing social distancing guidelines. In one particular county, it's actually a hotspot county, somebody reported that they called the health department for some help in making sure those guidelines were enforced. The health department said they needed to call state police. State police said they needed to call the prosecutor's office, which was then closed because of the pandemic. So my question is, how do people go about making sure that they are feeling safe, that those rules are being consistently followed, and who should they reach out to if they're finding that they're not?
Yeah, Amanda, you've heard from me 50,000 times on just that, and I'd like to at least just say this, if you're one of our local police departments, you're one of our state policemen, you're one of our, health department, county health department people and everything, maybe first responder, National Guard, whomever it may be, can you just imagine how you are being bombarded by people that are calling up and saying, I just went by Walmart and I saw Cousin Eddie with, 14 people hanging out in front of Walmart. Or I just went by the Dollar General and there's 18 people standing out there talking, smoking. Can you imagine the stress and the effort that is going in to trying to achieve the numbers that we're achieving? And these people deserve a lot of credit and everything. And I guess I'll pass the ball on to you, Brian.
Amanda, from day one, the governor's directed our state police to enforce these orders that he's put in place. And I can tell you, without fail, anytime somebody from the governor's office has contacted them, they have gone out to businesses to inspect. And I'll tell you that they haven't had to rely on the prosecutor's offices to do their job. So I don't know that the report you got would be accurate. I know our state police know that they have an obligation to go out and inspect these as they're asked to, and they've done that, again, without fail when we've asked. So I'm sure that there's been some miscommunication there.
And let me jump back in and say, Amanda, your question is a great question, and we all know that, because of photographs and everything we've seen, we've all seen Lowe's parking lot just jammed full of cars, and we all know that people can be doing a lot better in situations. And we all know the effort that's being made to get people to take it as seriously as they possibly can. It's our human nature to think, this isn't going to happen to me. It's not going to happen to me. It's exactly the same thing I've said so often. There's 40,000 people that get killed on our highways every day, or not every day, but every year. But you can bet your boots that not many of them are getting up that morning and say, hey, today's the day I'm probably going to get killed on the highway. And so we just absolutely have to realize the magnitude, the seriousness of this whole situation, and continue to try to love our neighbors and inform our neighbors and help one another to try to keep the social distancing and keep all the practices moving the way that we have moved them thus far, and we'll get through it. But that's what we got to do.
All right, thank you. We have time for one more question. Let's go to Mark Curtis with WOWK.
Folks, Governor, in this discussion about reopening the state, have you or your staff or the White House discussed the possibility of partially reopening the state? It occurs to me we have 12 counties that are hotspots, but 43 that are not. And one could imagine a scenario where much of the state got reopened, but those particular crisis counties would stay closed down. Is that even a possibility?
It's an absolute possibility, Mark. And the reason for that is, just look at it this way. It'd be nice if we could all go back to work. But what happens if we all go back to work and we have a real hot spot happen? Well, then we're going to have to shut that hot spot area down So, why not reverse engineer it to say, well, you've already got the hot spot and over here you don't. And instead of waiting in every way until we resolve every single issue, it's absolutely a possibility. But I would just tell everyone just this, and this you've got to count on. You've got to count on the fact that I want us going back to work, and I want us going back to school. I want us to absolutely get back to a life that's as close to where we could possibly be as soon as we possibly can. But, and this is a great big but, I am not going to do something that I feel in my heart is the wrong thing that's going to endanger our people. I'm not going to do it. And I'm going to rely heavily on our experts. And that's what I think you've got me in this position to do, and that's what I'm going to do.
All right, Governor, I'll turn it back to you.
Well, I've pretty much said, about everything. I would like to say that, our trend line's still good. As far as our total testing, we are total testing a percentage higher than that of the United States and higher than any of our surrounding states, with the exception of Pennsylvania, and we're running almost neck and neck on a percentage basis with Pennsylvania. As far as our positive number of tests, just to tell it like it is, as far as going back and doing the things, there's a buku of states out there that would give anything under the sun to have the numbers that we have. We're trending at about a fifth of what the U.S. trend line is, the whole national trend line. We're trending half of what any of our surrounding states are with the, we're trending half of Kentucky, and we're trending, as far as Maryland, Ohio, Pennsylvania, and Virginia, significantly better than that. In some cases, we're trending as much as a fifth, or as good as a fifth of those states. But, I just go back to where I led off today by saying, we do think that we could do better with the nursing home situation. You just think about Wayne County. We've only got just a sprinkle of people in Wayne County that have this issue other than that at the nursing home. And maybe we could have run to the fire a little better there. Maybe we have an issue in Jackson County or maybe Kanawha County or wherever it may be, that we can do better. And that's why that's the reason for the executive order today, that we're going to test everyone. I'd like to say this: our National Guard is working on a system, a graphic that we're going to have soon, and hopefully it's going to enable us our ability to track hot spots and be able to post them on our website to where you can see exactly in real time what we're doing in regard to that. And the last thing I'd say is just this: West Virginians, please listen to me. Please stay the course. You have done incredible work, and there is true light at the end of the tunnel. There's true light at the end of the tunnel. I've told you many times, when I'm going into a tunnel, there's no light, I'm probably not very good. But if you can show me a sprinkle of light, I'm as good as there is. And we're going to get there. We're going to win this battle. Thank you so much.